will now continue our discussion on the Regional Director's address and the general debate, which we suspended this afternoon. And I have the following speakers on my list: the Republic of Moldova, Serbia, Turkey, Ukraine, Denmark, and Belarus. And I would like to invite the Republic of Moldova to deliver their speech, followed by Serbia.
Thank you very much indeed, Madam Chair. Madam Regional Director, Director General, ladies and gentlemen, I would like to begin by thanking you for an excellent report, Madam Regional Director, on the work done in the European region and the success achieved. We have to note that when it comes to sustainable development, particularly in line with the 2030 agenda, we really are making progress in the European region. However, like many other countries, we are at present in Moldova analysing the way in which we can best move forward to ensure that we fully achieve the SDGs. We want to leave no one out of what we are doing, and that is at the very heart of the kind of medical service that we seek to provide in accordance with the ongoing reform of health reform that we have noted in Moldova in recent years. I think there are a number of key elements when it comes to enhancing our health system in Moldova. Firstly, enhancing PHC. Secondly, reforming the hospital sector, and thirdly, restructuring our public health facilities. We also recognize the importance of cross-sectoral work, and all that we are doing would be impossible without the valuable assistance and support of WHO in developing policies and strategies for our country. However, we know that what WHO does goes well beyond what I've already referred to. We know that assistance is given to us in developing our legislation, and also we seek to ensure that our legislative provisions are in line with the standards of the EU. We also have an appropriate strategy for the training and ongoing development of health personnel that's very important to us and that is also undertaken in accordance with international standards. We know that the IHRs are particularly important to us also, as well as efforts to combat NCDs as well as communicable diseases. We are very grateful to support received from Gavi in that respect. And we are at present involved in a very significant 2-year trial project. Universal coverage for all of those who are affected by hepatitis C as well as HIV/AIDS is very important for us, and we've been able to achieve significant progress there, again thanks to WHO support. I would like to thank you for all of the assistance you have given us in seeking to enhance our approach to sexual and reproductive rights and human rights in Moldova. I would note in particular the work that we have done on IHRs, including support provided by a number of countries, including Norway. We are very interested indeed in the next few years in undertaking a joint analysis and assessment of what we've done so that we can do even more, especially in terms of crisis preparedness in Moldova. We recognize that we have room for improvement there. Let me conclude by thanking the regional director and all of her team for all of the support they have given to us. And we know that thanks to the facilities we have been able to strengthen in our country, we are really helping many people to live longer and to live better. And also thanks to the support we have been given, we are better prepared as a country to respond to crisis situations. Particular thanks are due to Madam Jakob. We know recently she visited the Republic of Moldova. That was actually in November last year, and it was a very successful visit. And she was accompanied by Her Highness the Crown Princess of Denmark. This was something that was of great significance for us and allowed us to focus priorities on the needs we have for reforming the health system in Moldova, and particularly focused on the importance of maternal and child health, efforts to promote immunization and vaccination in the country, as well as efforts to combat AMR. We should also note the work that's done by the country office in Moldova, particularly in providing us with high quality assistance that is reflected in what we have achieved in our country. What we have done would not be possible without our many development partners, including the European Union, as well as representatives of various country offices under the auspices of the UN. People from Sweden, Romania, Germany, Turkey, and others assist us. And all of this is, of course, appropriately coordinated by the WHO. We have regular ongoing meetings involving all of our development partners that are coordinated by the WHO for health purposes. And we recognize the importance of the work that's done also with the Ministry of Health in our country. A great deal has been done. A great deal remains to be done, but we are resolute in moving forward in this area so that we can actually achieve even more in future. And that will be done in accordance with indicators that will be accessible both within the country and beyond it. Thank you, Madam Jakob. Thank you to all of your team for your commitment and your assistance to us as we seek to achieve the goals we have set ourselves. Thank you.
Thank you very much, and I give the floor to Serbia, followed by Turkey.
Thank you. Madam President, Madam Regional Director, Dr. Zsuzsana Jakob, ladies and gentlemen, distinguished colleagues. Madam Regional Director, thank you for this excellent report. The Ministry of Health of the Republic Serbia has a long-standing, very good cooperation with WHO in various fields, including topics to be discussed during this regional committee as AMR, ECD, health workforce planning, and now our joint focus is to strengthen our health system for better NCD health outcomes, including improvement of better service delivery at primary health care levels, its alignment to our new public health strategy, and a reform of the health financing system to meet universal health coverage. Our national health plan earlier was adopted in line with Health 2020, and now in the era of Agenda 2030, we need WHO support more than ever before to put health and well-being of our people as a key cross-cutting goal into the heart of our national development plans, and we need practical, pragmatic, and innovative tools and evidence to translate into national actions. We have started this multi-sectorial approach as the government of the Republic of Serbia recently formed an intersectorial government working group for implementation of the 2030 Sustainable Development Goals. The intention of the Ministry of Health is that strong coordination and expert support from the WHO, we can put health higher on the national agenda and mainstream health through other goals. This is a very important topic for us, especially bearing in mind the EU accession process and importance of its alignment to SDG. We have good experience working with other sectors as education on environment sectors, and we are happy to share some of our good practice as we have done in a recent ministerial conference on environment and health in Ostrava, as Serbia is providing presidency on protocol on water and health till 2019. The new 13th January program of work, as well as the new Director General Dr. Tedros' key priorities calls for stronger partnership and collaboration in county and among countries in achieving our joint commitment in the frame of SDGs and leaving none of our people behind. We can't lose this opportunity and momentum, and let me express our gratitude for WHO for all support in our joint efforts to improve health outcomes and health system in Serbia, and we are looking forward to our future cooperation. Thank you.
Thank you very much, Serbia, and I give the floor to Turkey, followed by Ukraine.
Director General, Madam RD, Mr. President, distinguished delegates. Before I start, I'd like to thank the Hungarian government for hosting this meeting in Budapest. With the fruitful discussion we'll have during the next 4 days, I believe it will serve just as good as previous one to global health and our region. Madam Director General, I thank you for the comprehensive presentation and report on Secretariat's work, which is diversified in many different areas. Both the presentation and report was a demonstration of Euro's leadership on bringing partners together and paving the way for the improvement of health status in our region with a holistic and multisectorial approach. The volume of the works in the report shows the success of our regional office, but it also underlines the magnitude of works that should be done in future. Ladies and gentlemen, the SDG era that we live in the time for us to set new targets. Therefore, it is essential to adopt and update strategies, targets, and roadmaps to achieve those targets for all stakeholders of humanitarian development. Within this scope, the roadmap which will lead us to achieve SDGs is of utmost importance for our region, because the roadmap will guide us not only at regional level, but also at national level, and national implementation of SDGs is the critical point. We prepared our strategic plan in Turkey with this perspective. Actually, this roadmap is a clear evidence of that we successfully carry out our activities to implement Health 2020 in our region. Today, I'm pleased to see the coherence between Health 2020 and SDG roadmap. So once again, I would like to thank you, Madam Regional Director. Ladies and gentlemen, unfortunately today we witness emergencies all around the world, and our region is dramatically affected by them. Land of Immigration and Health Chapter, as Susanna Jacobs reports, is a good indicator of this fact. As clearly mentioned in Madam Jacobs' report, Turkey hosts approximately 3 million Syrians under temporary protection. Including the refugees from the other countries, the total number is more than 4 million, and it makes Turkey top refugee hosting country. As a result, Turkey became the country spending the highest proportion of its GDP to foreign aid. On the other hand, social determinants of health for Syrians are improved with multi-sector action, allowing them to grant work permit and better integrate to the society. Syrian health workers benefit from the opportunity as well, and many of them are working within Turkish health system to provide migrant-sensitive health service. Approximately 1,642 Syrian healthcare professionals were trained, and 400 of them are currently employed in migrant health centers. Lastly, I'd like to thank Secretariat once again for the priceless efforts to improve health status and equity in our region. Turkey believes persisting on current path and empowerment of health as a humanitarian value and promotion of health will only do well for our countries, region, and the world. I thank you.
Thank you, Turkey, and I give the floor to Ukraine, followed by Denmark.
Thank you, Madam President, Madam Regional Director, Director General. First, I'd like to thank the World Health Organization for its leadership in global health, specifically in the leadership that was provided in my country. The Regional Director, as well as Dorrit Nitzan and Marta Everard, who were our country directors before and the current director now, have been truly helpful in helping us to reform the healthcare system. And the roadmap that has been presented for SDGs and Health 2020 has been the roadmap for reform in our country. We are now on the verge of true healthcare reform in Ukraine. There is a law, Bill 6327, which is in the docket to be voted on in Parliament at the end of this month, which will completely revolutionize the way that we provide healthcare for our citizens. And the manner in which this healthcare bill was produced, was established, has to do with leadership that was given to us and guided by the World Health Organization. We're reducing health inequities by addressing all determinants of health and providing universal health coverage for our citizens. Just today, the President of Ukraine had an event in which he announced that 1.5 billion hryvnia will be directed towards healthcare in villages and remote areas. We're increasing institutional capacity. We're strengthening and mobilizing the effective use of our national resources, and we're implementing both a whole-of-government approach and a whole-of-society approach, where we include civil society in the changes that are taking place. Our National Information System for Healthcare, called eHealth, is part of the bill, part of the new law, and will be instituted as soon as the law is passed. We're also proposing a law on public health for the first time in Ukraine, which will be presented in December of this year. All of this has happened in the last 3 years in a time when Ukraine has been at war. The illegal annexation of Crimea by the Russian Federation, as well as the presence of Russian Federation military in eastern Ukraine, has caused over 2 million Ukrainians to be displaced internally, and our internally displaced persons have created a burden on our healthcare system. Despite these challenges, with the help of the World Health Organization, we've been able to move forward over the last 3 years, and we are now on the brink of providing true changes and reform in our healthcare system. The roadmap that you present has helped us to change the way that we provide healthcare in our country. We stand alongside our colleagues in Turkey who also have an issue with helping those who are displaced, and we together can work so that we can provide the best of healthcare for those who are displaced as well as those citizens in our country. Thank you for your report. Thank you for the work that you've done, and I look forward to working with you in the future.
Thank you, and I give the floor to Denmark, followed by Belarus.
Thank you, Madam President, Mr. Director General, Madam Regional Director. Denmark is fully aligned with the statement made by Estonia on behalf of the EU and its member states. We thank you, Madam Regional Director, for your comprehensive report, and we thank you, Susanna, for your continued strong leadership. Let me also thank the Hungarian government for hosting our meeting in this beautiful city of Budapest. Non-communicable diseases are one of the major health challenges of our time. With the European Action Plan on NCDs last year, we took an important step towards preventing premature death and reducing the burden from NCDs. But we need to do more. Denmark is committed to do our part, and the Danish government has given a very high priority to the fight against NCDs in our national 2030 implementation strategy. Denmark looks forward to the WHO Global Conference on NCDs in Montevideo next month. We support a strong and focused outcome document that will help us prepare for the third high-level meeting on NCDs in New York next year. The regional office continues to play a vital role in assisting member states. During the last year, the Danish Health Authority has received valuable technical support from the regional office in relating to the challenges to our childhood immunization program, especially as regards to the remarkable decline in support that we have seen to the HPV vaccines in Denmark. Earlier this year, the Danish Health Authority, in partnership with a broad spectrum of local actors, launched a nationwide campaign to address misconceptions in society about the HPV vaccines, with the aim to improve vaccine coverage and to save lives. I want to thank the highly skilled staff of the regional office for their support in this regard. Just this morning, we released new data on our vaccine coverage in Denmark, and I'm happy to report that we are seeing the effects of our efforts. Since launching our campaign, we have in the last year doubled the number of HPV vaccines delivered in Denmark, and we are very confident of reaching our goal of, again, achieving more than 90% coverage of 12-year-old girls. Her Royal Highness, the Crown Princess of Denmark, in her intervention this morning, underlined that we will not achieve the health and development targets of the SDGs unless we ensure access to sexual and reproductive health and rights. Ensuring health for all, regardless of age, gender, income, or sexual orientation, is a key priority for Denmark. In that regard, the Danish government has launched a number of new initiatives to ensure the health and rights of LGBT+ persons. Leaving no one behind is a core principle of the 2030 agenda. Health for all remains our common goal and purpose as members of the WHO. Thank you.
Thank you, Denmark, and I give the floor to Belarus.
Добрый день.
Good afternoon, ladies and gentlemen. Good afternoon to the Regional Director. The Republic of Belarus has always been very committed to the principles that are outlined in the implementation of the Health Policies 2020 when it comes to extending the lifespan and abolishing inequalities. And as a result of that, the Republic of Belarus has adopted a program on democratic safety and health for up to the years 2020, and assistance is given primarily to maternal child health, preventing HIV infection, and solving many other problems. The basic principles that the health system of the Republic of Belarus is directed at is strengthening health systems that are people-oriented and to ensure the extension of health care and assistance that is given, as well as measures that ensure that healthcare is given primarily through clinical procedures, and to extending our equipment, our material basis, and to solve problems of staffing. The Republic of Belarus actively tackles problems of health for refugees and migrants, and this is directly linked to the health program of 2020, which is being implemented in Belarus for the first time, thanks to the WHO in Belarus. We're looking at problems of ensuring preventive measures for HIV/AIDS. And we want to look in particular to matters relating to questions of infectious diseases and the prevention of non-communicable diseases. In conclusion, I want to thank the Regional Director for holding the Minsk Regional Conference, which took place in Belarus in 2015. We're taking every measure to ensure that we act in good time and to ensure good information, and that these programs are all aligned in ensuring that we achieve these aims. I want to thank those who have organized this event, the government of Hungary for organizing the conference, and for their great welcome and hospitality. Thank you.
Thank you very much. As there are no member states asking for the floor, I would like to give the floor to observers, and I would like to invite Ms. Marijke Wijnroks, Interim Executive Director from the Global Fund to Fight AIDS, Tuberculosis and Malaria. The floor is yours.
WHO is a key partner for the Global Fund, and our partnership is particularly strong in this region, not in the least because of the energetic leadership of Susanna and her team. Over the last years, we have worked closely together to make sure investments drive results and impact, and to support strong and resilient systems for health, including reformed models of care and financing. Since 2004, Global Fund has invested $2.4 billion in the region, in Eastern Europe and Central Asia, and collectively we've achieved a lot in fighting HIV and TB. Many countries have made progress in providing HIV prevention services for key populations, and particularly people who inject drugs, a key affected group in the region. 90% of all Global Fund investments in harm reduction have been in this region. The region has also seen significant decreases in TB incidence and mortality rates. And in a presentation this morning, the RD mentioned that the pace of decline is the fastest in the world. Access to TB treatment has increased and quality of programs improved. Whilst this is all great progress, the fight is far from over. The annual number of new HIV infections continues to increase in this region at alarming rates, as the RD mentioned. This is in sharp contrast with global trends that show declining incidence in other regions. Large gaps also remain along the treatment continuum, and treatment coverage is at a very low level. Levels of MDR-TB are increasing in many countries in the region, posing serious challenges to countries, the region and beyond, because in a globalized world, we are all at risk. Domestic funding has increased, but in most countries still falls short of what is needed, and funding is not always targeted for maximum impact. And that in a context where a number of countries will transition out of external funding, including from the Global Fund, in a short or medium term. In order to sustain the gains that have been made, and to make the much-needed progress on reducing HIV and TB infections, including MDR-TB, we need to all work closely together. We will need to make sure that all investments, from domestic and external resources, are based on evidence and follow WHO guidance to achieve maximum impact. And we need to reduce inefficiencies in healthcare delivery. It's encouraging to see that a number of countries in the region have embarked on ambitious health sector reform programs. Equally important is tackling stigma and discrimination and the legal and other barriers that limit access to health for key populations, including people who inject drugs, LGBT populations, migrants and prisoners. We know this can be done and we know you can do it. But it requires ambition, a sense of urgency and bold political leadership. As RD said in her opening statement, health is a political choice. We stand ready to support you in this important journey in close collaboration with WHO Euro, Susanne Jakob and her amazing team. Thank you.
Thank you very much. And I now invite the representative from UNAIDS to make his statement.
Thank you, Madam Chair. Ladies and gentlemen, on behalf of the United Nations Programme on AIDS, let me thank the Regional Director for her comprehensive report and her consistent leadership on aid in AIDS. The latter, however, remains unfinished business in the majority of member states in the European region. The report of the Regional Director gives evidence to the excellent teamwork at WHO, at the Regional Bureau and in country offices. Working as part of UNAIDS, WHO's work on HIV is more important than ever. WHO's technical leadership continues to be indispensable and instrumental in many areas, ranging from HIV testing to immediate treatment for everyone, to the elimination of mother-to-child transmission of HIV, to halting comorbidities such as TB and viral hepatitis, to name a few. In 2017, we are observing a sad milestone, especially in Eastern Europe and Central Asia, where HIV relentlessly continues to grow. If we don't stop the HIV epidemic now, the European region will, once again, be one of the only regions of the world not to meet HIV fast-track targets by 2020. If we don't stop HIV epidemic now, we won't stop the epidemics of TB and hepatitis C either. UNAIDS strongly believes that AIDS response in the European region must stay high on the agenda of WHO Regional Committee and on the agenda of every Minister of Health. We see true breakthroughs of positive change in many countries where health ministers personally demonstrate commitment to AIDS response. So we are counting on your continued support and commitment in all European member states and continued leadership of the Regional Director to reach the HIV fast-track targets by 2020. Thank you.
Thank you very much. And I now give the floor to the representative from the United Nations Environment Programme, UNEP.
Thank you, Madam Chair. On behalf of UN Environment, let me start by thanking Susanna for the interim report and for your leadership not only in the WHO Europe region, but also in the work of the UN Development Group for Europe and Central Asia, where you have put health in the center of our agenda. This platform is also an important entry point to advance the 2019-2023 general program work that was presented to us a few minutes ago. UN Environment very much values its partnership with WHO at all levels. We are very pleased to have jointly organized the Ostrava Ministerial Conference on Environment and Health, where We focused on key environment and health issues linked to air pollution, water sanitation, climate change, chemicals, waste, and cities. What is also more alarming is we cannot afford to have 1.4 million of our citizens, whether it is death or disease, affected by environmental risk factors. This morning we learned a new word in Hungarian, egész. It means whole of, entire. I think that's an excellent way of describing the responsibility we have to our citizens and the environment. Citizens' health and environment are deeply linked. We are working in tandem with many of you in terms of decarbonizing the energy systems, detoxifying our lives, decoupling our economy from unsustainable practices. We talked a lot about alignment, coherence. I think that is one of the things we are doing in terms of the UN Environment WHO partnership. As I speak, we are currently preparing for the UN Environment Assembly, which is the world's highest level decision-making body on environment that will be meeting in December, bringing the 193 member states of the UN. Our main focus is how do we move towards a pollution-free planet, which is almost the same as the agenda that we have in the context of the Health 2020 or the 2030 Agenda for Sustainable Development Goals. This assembly will focus on the evidence of a polluted planet, including the science, the impact, and the economic cost when it comes to whether it is air pollution, marine pollution, whether it is soil pollution, fresh water, chemicals, waste, name it. UN Environment Assembly will look at the opportunities for addressing and achieving a pollution-free planet through the implementation of the 2030 Agenda, but also partnership through regional processes like the work we do through the European Environment and Health process. We sincerely hope the Director General will join us in December at the Assembly. We must beat pollution. We must beat pollution, and we need to get as many people, institutions as possible to join us in this effort. Last but not least, I would like to thank my sincere gratitude to the team that is working at WHO Europe in terms of health and environment. They have done a great job. They deserve everything, every thanks that is possible. Having said that, let me also wish the new Director General a very happy Ethiopian New Year. Thank you.
Thank you very much, Dr. Jakob. There have been a number of comments made and specific questions raised. You may wish to take the floor.
Thank you very much, Madam Chair, and thank you very much to all of you for this very rich discussion. And I am really touched by the great support and the collaboration and all the guidance that you gave us. I would like to congratulate to each and every one of you for the progress, for the success, achievements in your countries, and for the political leadership. I would like to thank you also for hosting many of the events, inviting us for official visits, and to work with you to support your initiatives, and also offering your expertise in many different areas. In spite of the good progress, of course, we are fully aware that we have many challenges. I have highlighted some, you have highlighted many, and I listened to you very carefully. And I promise you that I will report back to you on progress made on these areas, like, for example, you asked us to further develop AMR national plans. We are committed to that. We are working on that. You mentioned the issue of abuse and violence against children and women. You know, it's a priority for us. We presented it during the last year's regional committee. Many of you mentioned the challenge of the NCD and mental health in the region, particularly Estonia on behalf of the EU countries, and of course, it is a big priority for us. And in the spirit of solidarity, not solidarity, but accountability, every year we report back both in writing and also orally on all the progress made and achievements, and we take this item very seriously and we give you a full report, and this is what we will do with all the areas that you have raised. There was one particular issue that was asked for clarification, and this was from Estonia on behalf of the EU countries, and I would like to respond to this one request for clarification. Estonia asked me whether the current budget adequately addresses the needs of the European region. And with regard to this, I would like to say that the program budget for 2016-17 as of August this year is financed at about 90%. However, there are some program areas that are financed below 75% or even below that, and this is what we call pockets of poverty in the report that we have distributed to you. And these areas include some of those that are important and priorities for our region, like environment and health, like maternal and child health, nutrition, health information, HIV, aging and health, and also mental health. And we are very closely monitoring these areas, and we try to do as much realistic planning as possible. And also when we receive flexible funding, these are the areas that receive priority in the allocation of the flexible funding. At the same time, I would like to point out also that during this biennium, we received about 8% less flexible funding in euro than in the previous biennia, and this impacted mostly these areas which we call as pockets of poverty. We hope and we think that during this biennium we will manage with the funding that is available for us now if we also receive, or once we also receive funds that are now in the pipeline. However, the next biennium might be a challenge. And this misalignment of programmatic priorities, it is not only unique for WHO Euro, but it is an organization-wide challenge. And the optimal solution to finance those areas that are high priorities and where it is normally very difficult to get extra budgetary resources, the best way forward is to finance them through flexible funding. Of course, it is important to point out that at this stage, with the new Director General who considers resource mobilization as one of his priorities and he's testing out new ways forward in resource mobilization, we look forward to get more flexible funding to the regional office, and we hope that the 2018-2019 biennium will be fully financed as approved by the World Health Assembly during May 2017. So I hope that this reply is sufficient for the delegation of Estonia and member states of the European Union, and look forward to give you more clarification should there be a need. And with this, ladies and gentlemen, member states, partners alike, I would like to thank you once again for the great collaboration and for the excellent support that we have received from you today and throughout the last year. Thank you again.
Thank you, Dr. Jakob. We can now consider the adoption of the proposed draft resolution contained in EUR/RC67/ConfDoc1, report of the Regional Director on the work of WHO in the European region 2016-2017. Is the committee willing to adopt the proposed draft resolution by consensus? I see no objections. Then the resolution is therefore adopted.
Great.
As all of you realize that we are behind the schedule, and to save time, I propose that the report of the 24th Standing Committee of the Regional Committee for Europe will be distributed in written, so then you can review it and we come back during this session and to the resolution on this agenda item. Is this acceptable for all of you? I see nodding. Thank you very much.